Hello and welcome to the program. My name is Marie Yambo. So what is bone marrow transplant and what are some of the diseases that can be managed or cured using a bone marrow transplant? Well, to take us through the topic today is Dr. Kibet Shikuku, who is a hematopathologist, a University of Nairobi lecturer, and also a consultant at the Nairobi West Hospital. Welcome to the program, Dr.
Thank you, Marie.
So, Dr. before we talk about so many other things, including some of the diseases that can benefit, can I say, from bone marrow transplant, maybe we need to start by, first of all, demystifying, or at least explaining to us shortly, what the bone marrow does in the human body.
Yeah, so thank you. Bone marrow, is one of those areas that men love sucking when they go for their usual meals in joints,
Yes.
because it has fat in it and quite juicy. And from a layman's perspective, it's basically a factory where blood is manufactured. And there are three types of blood. We have white blood cells, red blood cells, and platelets. So these cells are actually produced in this factory that we call the bone marrow. So, and it is found inside the bones, okay? So all our bones, most of our bones have that capacity to produce, blood cells.
Okay, interesting. And also, when we talked earlier on, we talk about bone marrow transplant, but actually you said that it has nothing to do with surgery. You could explain to us what bone marrow transplant then is, if it has nothing to do with surgeries.
Yeah, so I think it is important that we try to demystify this terminology, transplants, because a lot of us are used to, a scenario where someone has to be taken to theater, something done, some surgical procedure done, or the bone marrow, the bone basically being removed and someone doing some surgery on it to harvest something in it. That is far from it. So basically for the transplants that we are talking about that involves the bone marrow, we again need to redefine that terminology a little bit. Okay. Because the whole process is about harvesting within the marrow a cell of interest we call the stem cell. That is the entire cell that is of interest to us. Question is, how do we get this cell from the marrow? Because this cell is resident in the marrow. Do we go and suck it? We could do that. We can actually literally push in a needle into the marrow and we suck these cells. And actually that is how the whole terminology of bone marrow transplants came into existence. Okay. People used to go into the long bones, suck the marrow outside, very painful. So it used to be a theater procedure, okay? But technology has evolved to the extent that instead of us getting into the marrow and sucking it, now we use drugs to stimulate that marrow so that the stem cells can come out from the marrow into circulation. Okay. And we can be able to harvest those cells externally without necessarily disrupting your marrow. Because sucking is painful, it disrupts that marrow, and you may not even harvest enough. So lately, with the technology, we just stimulate that marrow, we harvest the stem cells, and we can determine the amount that have been harvested for now us to utilize later for a patient that is in need of those stem cells. Yeah,
interesting. And probably you could tell us, apart from just using the drugs to stimulate, the production of this particular stem cells that a doctor could be interested in, just the process itself, because people would want to understand, is it something that is painful? Is it something that I will have to be admitted in hospital or something like that?
So basically we will split the processes, based on the various stages and steps involved. The first step is stimulation. At the stage of stimulation, we only give you drugs as an outpatient. Yeah. So you come to the hospital, we give you this drug that stimulates the marrow for 2, 3, 4 days, you go back home. Then when we are ready to harvest, now we admit you at least to harvest the stem cells. Yeah. If we think the cells that have been harvested are adequate for us to use during the transplantation, then we admit you as a patient. So again, this is dependent on the type of transplantation that we are undertaking. If it is autologous in nature, which means You, who is the recipient, is actually the donor of your own cells. Okay? That is autologous. You become your own donor. If you are your own donor, then you'll be stimulated, cells harvested from you, and then those cells are kept so that you are now prepared for the transplantation itself. And the process of transplantation requires that we actually take you through a stage we call conditioning, where you are given high dosages of chemotherapy drugs that can destroy whatever is causing you problems. If it was cancer, those cells are destroyed. Okay? If it was something that needed to be destroyed completely, then we use these drugs to destroy it. Okay? So once the marrow has been destroyed, including the abnormal cells that were actually causing problems, now we can come in a little later to give you back these stem cells that we had harvested. All these processes require that you are taken through a special facility that is under positive pressure, because that facility protects you as a patient when you have been given these particular medications that destroy everything within you and literally sterilize you as a person. So you get sterilized to the extent that, you know, even a fly just passing by with some microbes can cause you problems. So for us to avoid that, we take you to a room that is highly sterile, so that then, you know, you can come out of that sterility as the cells that you are given start taking and producing now newer cells that can support you and protect you as time goes by.
So you talk about autologous transplantation.
Yes.
And then there is...
there is another type that we call allogeneic that I can talk about also. So allogeneic basically means you are getting, you know, stem cells from another person to give them to another individual. So the person who gives is a donor, and the person who receives is a recipient. We have conditions that require that you get stem cells from someone else and you give them to someone else. And sickle cell, for example, as one of the diseases, may be one of those that can benefit from such an arrangement, where a patient is born with abnormal cells because the gene that produces those cells is already abnormal. So you want to destroy these abnormal cells and bring in normal cells from someone else. So those ones fall under what we call allogeneic. And there are a series of conditions that can benefit also from that type of transplantation.
Okay. And we'll delve a little bit more into the types of diseases that can actually benefit from bone marrow transplant. But just to understand, first of all, a lot of Kenyans, or many Kenyans for that matter, travel out of the country to go get a bone marrow transplant. It's expensive, it involves definitely traveling and all that. But this is a service that you can actually benefit from right here in the country. So what would you tell Kenyans, especially when it comes to the management of these kind of diseases that need for you to have a bone marrow transplant? What are the benefits of actually doing it here in the country vis-a-vis doing it in another country?
So thank you. So being a Kenyan really, you know, makes me speak with a lot of vigor, a lot of energy, and tell fellow Kenyans that bone marrow transplants are now readily available in Kenya. We know that the Nairobi West Hospital is one of the private facilities that has started offering bone marrow transplants. And we have conditions that can benefit. Multiple myeloma, sickle cell can benefit, aplastic anemia, multiple sclerosis, leukemias, and I think the list can be extended as we move along. And these are conditions that can readily benefit from transplants offered locally here. Why is this important? This is important because bone marrow transplants are not cheap. They're expensive procedures. But we can taper the costs as a country. We can also provide quality that you may not be able to be guaranteed when you travel out of the country. You have access, you know, to your patient. If you wanted to see the patient who has been admitted for a bone marrow transplant, you can just walk into the facility and you can be able to see this person. You don't have to necessarily overburden yourself having someone traveling with you out of the country. Language, food, there's so much that goes into these processes that, you know, people have to travel out of the country. So if we all figured out how to support processes and support Kenyans locally, we can actually be able to reach more. We can also tailor our care to specific disease entities. For example, we know as a country that sickle cell is a big problem. How can we, you know, tailor our services to support sicklers so that they can get cure for sickle cell? They also need to have a life. People with multiple myeloma, in the Nairobi West Hospital, we have a 6 bone marrow transplant unit, which means at any one time we can only support 6 patients. Okay? What does that mean? For every 1 month, if a patient is staying for 3 to 4 weeks in a transplant facility, then it means we can only manage 6 patients per month. If that facility was running daily, it means we can only support between 60 and 72 patients per year. Is that good enough? I mean, that tells you the enormity, you know, and the discrepancy and the, you know, the disparities in terms of availability of care for various diseases. So even if we just picked one disease like multiple myeloma, from 2 facilities, we have about, I think around 800 or so patients with multiple myeloma in 2 facilities. So if these patients were to benefit from bone marrow transplants, we will need almost 10 years to manage multiple myeloma alone. So we still have the need to have more facilities, develop this capacity, but then there should be some support from the government so that then more patients can benefit from this kind of procedure.
How then would you describe for you how this collaboration would look like?
So if you asked me, care lately is a function of both the private sector and the public sector. We all benefit from NHIF, for example, regardless of where you go. And so the government can determine, you know, or put limits within which facilities could function. And so if you asked me, there are many ways of collaborating and having conversations around provision of care. That's number 1. Number 2 is that, you know, remember, these facilities are benefiting from Kenyans with capabilities to support bone marrow transplants. And so a facility that has already started bone marrow transplants can start training other Kenyans to provide the same services. So we don't have to mobilize people to travel out of the country to get trainings. So these people can support various other facilities that are interested to offer this kind of services. Thirdly, as I did mention, we can create specialties. Some people can major in aplastic anemia, for example. Others could major in sickle cell. Others could major in multiple myeloma. So there are various aspects through which we can collaborate together as a country so that we provide specialized services to groups of patients that would have benefited as, you know, as Kenyans. So yeah, there are many ways we could actually work on this together, including determining the cost of care as a country that can be provided regardless of which facility you attend. So we need to really demystify this aspect of saying, oh, you know, this is private, this is public. The private sector, yes, may be interested with the profits, but they can be managed in a manner that for such services, you know, the country is in direct control without necessarily putting them in losses, but enable them to provide a service that is generally being provided out there anyway through the private sector. And so we should support them, you know, to build this infrastructure, build these services, support the public sector, and have these services now running both in the private sector and in the public sector.
Yeah, and you know, Dr. when we were talking earlier, you talked about some types of, say, cancers in which you have to undergo chemotherapy.
Yeah. And
chemotherapy itself will destroy definitely the cancerous cells, but at the same time destroy the bone marrow. But again, this is where now the bone marrow transplant becomes beneficial to such patients because then you can actually harvest the stem cells and regrow them, and regrow, can I say, regrow them in the bone marrow, or revive the bone marrow, for lack of a better explanation.
Yeah.
But at what point then do you decide somebody needs to actually undergo a bone marrow transplant and not necessarily just have can I say, a normal or conventional treatment?
Yeah, so I think this is a very important question, because this is where the conversation should be going as Kenyans. If you get a condition that a patient could potentially benefit from a bone marrow transplant, then you want to keep them on regimens or combinations of chemotherapy or drugs that are sparing to the marrow. You do not want to give drugs that will actually destroy the marrow. So as a country, one of the things we should be doing is to say which are these categories of drugs that if given to a patient who has cancer, for example, they can benefit from the next phase of treatment. Because we have regimens that can destroy that marrow completely to the extent that the patient may not even benefit later from a destroyed marrow. So this is where the conversation should go. Secondly, and I'll tell you, that we've started engaging colleagues from other countries. We spoke to the Nigerians the other day, and they're very enthusiastic to send patients here. The question is, as professionals, what should we do? And the issue is, which are these protocols that we can now start discussing as professionals to use? How do we prepare a patient? There are complications associated with the transplants. How should a patient who, for example, is young, who would like to have babies later, going through a transplant, what should happen?
Yeah.
You know, what message should we give them? How do we, for example, harvest organs that may potentially get destroyed, but we would like to keep aspects of those organs or products of those organs, eggs, for example,
Yeah.
you know, or spermatozoa. So these are things, these are conversations that we should have. Who should benefit from a transplant? What are the complications that would arise from this transplant? So this is where the conversation really should be heading. Remember, there are a lot of legalities around transplants. If you gave your stem cells, who should benefit from the stem cells? If you give too much of your stem cells, where should those stem cells go? Can people start generating and giving stem cells for use by other people? And if that was going to be the case, who really should regulate this? And I think this is where now the government, through the Kenya Tissue Transplant Authority, has been developed to try and see how they can regulate some of these aspects. But again, this is at the infancy stage. So we have a lot more that we need to converse as a country to support, stem cell transplantation. But I think of necessity is for us to then figure out which are the safer modes and safer mechanisms that we could use to prepare more Kenyans to benefit from transplants, rather than just subjecting them to processes that lead to, permanent, unfortunate outcomes where someone basically does not benefit from much more improved forms of care.
And maybe last but not least, how successful are bone marrow transplants, especially in the country?
Yeah, so I think as a facility at the Nairobi West Hospital, we've managed to do the first transplant as a country, and the patient is doing relatively well. This was a patient who came in with multiple myeloma. She was actually meant to be traveling out of the country, but she accepted to, and possibly the luck was that we also had colleagues, who have been transplanting in India with us, and we took this patient through the transplantation process. He's doing quite well at home. We are scheduling another set of clients to be transplanted in January, and we are hoping that we will get good outcomes. So generally, there are different outcomes based on the type of transplant that is of interest. Majority of the times, over 80%, you have good success outcomes. You get a small percentage that can complicate. You may get a few mortalities, but those numbers are now dependent on, the complications associated with the transplants. If you get a facility where, infection prevention control measures are not well taken care of, then patients will die from infections because of their lowered immunity. It's not the transplant process that kills them. It is actually now the things that go around a transplant that actually exposes them. I usually say, while you think a cleaner is useless, they may be the most important link, to just make sure there is no infection close to this patient. So aspects of infection prevention controls are key. The products you use are also important. The infrastructure, and that's why a lot of facilities may not be engaging in transplants, because the facility has to be within certain limits, and then you must have 3 negative cultures before a patient goes in there. Okay. So it's not just one of those walk-ins and walkouts. But if the facility is well done, 80-90% of the times to 100%, patients go home. What you expect is people who go in should all come out. You don't want to let others, be taken elsewhere. And I think our luck so far is that the patient that we took in, well, Kenyans who are wondering whether this person could come out, and waited possibly for something different, had this patient coming out and now is having good life at home.
Oh, okay. So it's a whole process in terms of ensuring that the process itself in terms of the bone marrow transplant is successful and in minimizing rejection for that matter.
Yes.
So I don't know, probably in your parting shot, in as far as this particular topic is concerned, what would you want Kenyans to take home?
So I want Kenyans to be aware that care at home is the best care. Secondly, care without a government is no care. We all belong to the government. And regardless of where we are, we should be supported. Kenyans need to get services regardless, be it in the private sector, in the public sector, and I think health is heavily driven by the National Health Insurance Fund. No Kenyan can benefit from a bone marrow transplant without the government's involvement. So a good allocation needs to be made so that then we can transition these patients from a chronic condition or chronic outcomes that consume more money than plunging an amount into a transplant, and you give cure for a longer period and you give quality life to this Kenyan that can actually contribute to our, to the growth of our economy. So for me, I think it is a cycle that we need to break very soon by ensuring that more Kenyans benefit, especially for those that can benefit from transplants sooner rather than later.
Okay. So thank you so much, Dr. Shikuku, for coming in and generally just educating us about what bone marrow transplant is all about and the processes that are involved, and even the fact that actually it can be done here in the country. And your parting shot that care at home is the best care that you can give to a patient. So thank you so much for coming in into the program. And thank you also for tuning in, and hope that you are able to learn a lot in terms of bone marrow transplant, some of the diseases that can actually be managed or even cured using a bone marrow transplant, and most importantly, that this service is actually available here in the country. So before you make any decisions, it will be best to talk to your doctor and see where exactly you can actually get these kind of services right here in the country. So thank you so much for tuning in. Remember, you can always log on to our Facebook page, that is KBC Channel 1 TV, to get more details or even to comment on this particular topic. We'd like to hear from you. So from me, it's goodbye for now. I'm Marie Yambo.